The best example of that is coming up with the Australian New Zealand treatment guidelines for ITP, specific for our region, specific for our patients. What's so critically important about that, I think it absolutely did shift, the approach to ITP treatment and really brought it into the modern era.
Welcome to Beyond the Count. I'm founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just curious about what life looks like beyond the bruises and the blood tests, you're in the right place. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count. Today, I'm joined by Dr Danny Hsu, consultant haematologist at Liverpool Hospital and medical advisor to ITP Australia and New Zealand. In this episode, we're exploring the vital role medical advisors play in bridging the gap between patients and clinicians. And Danny shares how advisors help shape treatment guidelines, support patient organisations, and ensure families feel confident in their care. If you've ever wondered how medical expertise and patient advocacy comes together, this conversation will give you clarity and reassurance. Let's get started. Thanks, Danny, for joining us today on Beyond the Count. Today, we are talking with Danny about the role of medical advisors like himself and understanding why they're an important part of some organisations like ITP Australia and New Zealand and other, healthcare charities. So, Danny.
Firstly, thank you so much for the invitation to be on your podcast. This is very exciting.
So for people who might not be familiar, what exactly do you do as a medical advisor, specifically in the context of ITP?
Yes. Well, in an amazing sort of position, in a way for us to provide some, expert guidance about the disease for organisations, like ITP Australia. And really is to share kind of our experience and knowledge to really ultimately provide, support to patients and also, of course, to other healthcare professionals about this rare disease that they might not manage quite as frequently as we do as sort of experts in the area. And I think very importantly as part of that is to also update, everybody, patients or fellow colleagues into the current, most up-to-date treatment or diagnostic sort of methods. And also, the best model of care, I think, and to really bring everyone up to date, just so that we are able to provide the best care that we can, I think, to our patients.
I think you're being very modest there. I think the other things that you guys definitely do, especially for us, is donating your time and your energy to attend our patient conferences, things like the healthcare professional breakfast that we hold at Blood every year, reviewing a lot of the articles and resources that we put out. Everything is scrutinised and had a look at by at least one of our medical advisors to make sure that the information that we're putting out is accurate and correct. So I think you're being quite modest there, my love.
I must say though, it's because there's such fun things to do to be able to contribute, and it's been such an amazing experience being part of this. Thanks to your really leadership, Danny. I mean, really, you're right. I mean, I don't even think about it as a job or a role at all, because it's been such a rewarding experience, to be part of the ITP sort of patient support organisation, like this, giving back in a way that I think was far more than what we would ever imagine. I think it's not just myself; it's all my fellow medical advisors, and we built such a close friendship, as with Phil and Rob. It's been such an awesome ride, all of us together. And there's a small way of just giving back, to our patients and helping to improve the understanding, I think, as I said, for our other colleagues as well.
And the one thing I do love that I think we don't talk about often, whether it's amongst ourselves or, with the community either, is how personable you guys are. So when it comes to things like the patient conference, you guys dedicate your whole day plus any, time, lead-in time to doing your, sorting out your presentations and those sorts of things. But patients really find it invaluable being able to talk to you guys one-on-one during those moments and during those events. And, that's the invaluable stuff, I think. Anyone can review paperwork and brochures and medical information, but it's the hands-on stuff that you guys do. And I'm really lucky, and I've always said that I'm super happy to have ITP because of it, I've got to meet so many amazing people, and I find that the community is one big happy family. It's the family I got, not the family I chose, but I definitely choose it over most others out there. That's for sure. You guys are like family. You're like absolute family.
Yeah, I think we are very lucky that, I think as a community, we sort of gel so well and we're fun people. ITP folk are fun people, patients or, doctors alike. But the patient conferences, it's been so much fun and so rewarding. And you and I both noticed that, really thanks to ITP Australia, New Zealand, I'll keep adding that. You've touched so many lives. And exactly probably the one particular patient that I'm thinking about where, he started off having these small meetings of just literally 3 patients it was. And to be able to change literally the life of one of those patients by, just kind of giving a second opinion of their disease. And it dramatically has changed her life. And
it changes the trajectory of how they see the disease and how they experience it as well, right?
Yeah, absolutely.
So talking about that and talking not necessarily just about this one particular patient that you and I are talking about, and we are going to keep the patient's identity to ourselves. From your experience as a medical advisor, how do you bridge the gap between patients and clinicians? I know we always talk about shared decision making, but how do you do that in your clinic and in your everyday experience with ITP patients?
Yeah, so great question, Danny. I think the basis of good shared decision making is knowledge, right? In that really empowering our patients with knowledge about their disease, just understanding the pathophysiology behind ITP, because then you could have a much more expanded conversation than about the treatment. And then leads to then a potential, obviously, complications which those treatments might potentially bring. But, empowering patients to really know, for them to understand the disease, to understand, how we monitor it, what a platelet count means, what a safe platelet count means. I think that's very important. Not what people Google or other doctors who might not be so familiar with ITP tell me to say platelet count. But by arming them with that sort of knowledge, you have a much better shared decision-making process, right? Because you have a much better chance of having an informed decision then in terms of your treatments. I think as simple as that, to just be able to educate our patients and give them good information that's evidence-based, and give them lots of opportunity to ask questions, and providing that safe environment, I think, where they're comfortable, asking you anything, because that's the thing, have patients, of course, where they hold back and they're like, I don't want to ask, that seems like a stupid question. I really try to break the ice and, try to connect with the patients in a way to say, hey, let's be honest, you've got a shit disease that you may or may not have forever, but we think it's probably going to be chronic. It's shit. Let's just acknowledge that. And but just breaking out that ice to then just really be able to talk frankly about their fears about, oh my God, I read about how, how could clinically bleed to death, and you've got to tell them that's absolute bullshit. To then you really to be able to break down some of the, I think, misconceptions, I think, that they might have the disease, whether it's something read online or been told by other people. I think that's a fundamental part of the shared decision-making process. Yeah, all those things.
I think one of the things that you guys do extremely well as well is plain speak. It's really easy to talk technicalities and medical jargon. But as you said, just don't sugarcoat anything. I was talking to a patient last week and I said to her, she's in hospital, has been for months. And I said, what you're going through is absolutely shit. Excuse the language out there if we've offended anyone, but frankly, it is. Like, especially if you can't go home, especially if you can't do the day-to-day sorts of things, and the disease is actually limiting you to really be able to live your life. There's no other way of saying it. Like, why dance around it?
Exactly.
Why dance around it? So I think that the way that you guys definitely, you guys really do lead by example for other healthcare professionals as well. And you see that at Blood, at ISTH, at all of these conferences, but then also in the background when a clinician calls you and goes, hey, I need a second opinion. Because as you said, not every clinician is going to know everything about ITP.
That's right.
And that's another place where you guys come in as well, is that you guys are up to date with everything. You guys are part of, making clinical trials happen and, all of those sorts of things as well, which I think is fundamental, absolutely fundamental in not just this disease, but, I think widely in medicine. So can you share an experience now or an example how you've influenced patient care through advocacy or through experience with another doctor?
Yeah. So, look, I think the best example of that is, coming up with the Australian New Zealand treatment guidelines for ITP, specific for our region, specific for our patients, given obviously every country will have different availability of different sort of drugs and therapies. And really, I've got to thank, my fellow medical advisors, Rob Bird, of course, Phil Choi, our, primary author. Phil was just a powerhouse, in terms of just gathering all the ITP kind of experts in the region to really put us into a collective singular space for us to really hammer out these guidelines. And what's so critically important about that, I think it absolutely, I think, did shift, I guess, the approach to ITP treatment and really brought it into the modern era, so to speak, and very importantly, convinced then our government in terms of how they view certain restrictions to the drugs to treat ITP, to bring out the last century, basically, felt like, to really bring us in line with really what is the modern management of ITP to our region. And that was probably one of the most rewarding things I think I've ever done, to be part of that. To come up with those guidelines are really important for that to then change the patient's access to treatments, in Australia. So, and hopefully soon to New Zealand. That's been incredibly amazing experience. In terms of influencing patient care, well, really the advocacy and sort of bringing, I think, awareness about ITP. And, we, I guess, do this obviously through the research that we do, and especially Phil, who's obviously have, as you know, the very, certainly, amazing research output. So he's, always been invited to give talks about ITP, to our fellow sort of medical colleagues. And I think that's really important because, as we said before, ITP is a rare disease. I think not all clinicians are used to seeing patients. Might have a handful, but a very big sort of, ITP cohort. And to share kind of our experiences, I think it will only benefit patient care, all right, by really sharing, advice in terms of how do you basically, manage our patients. I'm hoping certainly would improve patient care throughout the country.
I can guarantee you that you have. I can absolutely guarantee you that you already have. And it's, I think, as we all work together, whether it's patient advocacy, when we're talking about treatment guidelines, you guys developed these amazing guidelines, and we as an organisation spread them like glitter. And And I don't know of another patient organisation that does that. So I'm asking for forgiveness, not for permission, because right now we need to empower our patients. We really do. And for those clinicians that don't know about the changes, if a patient hands the guidelines to that clinician, that's again, that's another thing that you guys have done to help empower those patients. And I think it's definitely a team effort. It has to be a team effort. We all have to be working towards a common goal and putting patients first, which I think is absolutely amazing. Now, if you had another colleague, not necessarily in the ITP space, and they had been approached by another patient organisation to be a medical advisor, what would you say to them?
So I would say absolutely you should bloody do it. I mean, there's no downside to it at all. I mean, firstly, it's such a honor and a humbling experience, right, to be kind of acknowledged for your expertise in that particular area, and then really I think it's really an opportunity for to you to really contribute to patient care. You could really make a huge difference by sharing your expertise to whatever that disease state there is. It's incredibly rewarding. So I tell them, absolutely, you should bloody do it. I mean, there should be no hesitation. You should run, not walk, but run towards the bloody opportunity.
Run, do it now.
Yeah, just bloody do it. Absolutely, yeah.
Join the family, go in gung-ho and absolutely with both hands and feet. Because we do find that in some patient organisations, not here in Australia, but internationally, some medical advisors would like to get paid. And
oh, really?
Patient organisations, we don't have a lot of money. We're run off the smell of an oily rag, and we're all pretty much volunteers in the organisation. So, it's just, I'm quite shocked considering my experience and having you guys on as medical advisors. You guys are like, yeah, sure, no problem. I'll do this, I'll do this, I'll do this, I'll do this, I'll do this. We're already planning for the conference in March. And it's just, it's just fascinating to see other experiences from other haematologists and other potential medical advisors for different global organisations, which is bizarre.
I can't believe you waited years until you told me this, Danny. Jesus, all this time.
I pay you in love, Danny. You know that. I pay you in love. I pay you all in love.
100%. And yeah, and lots of wine when the occasion calls for it. Yes. Am I allowed to say that? Nah, too late now.
Wasn't it back in the early 1900s that treating ITP was copious amounts of wine?
You know what? Phil taught us that, right? Phil.
Yeah, I'm sticking to my roots.
Yeah. I'm gonna chuck Phil under the bus for that one. Yeah, so it's Phil. Phil told us it was okay.
I'm sure we've had it at quite a few of the patient conferences as well. So, that's no problems there at all. None whatsoever.
Exactly.
Thanks to our sponsor Sobi for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
Now, we've got a number of, not the prevalence of ITP, but it's becoming more and more evident that becoming more educated around ITP, and they're getting their information from different locations and different sources, but from reputable sources and those sort of things. Where do you think that they should be getting their information from, other than from the guidelines, other than our website? Are there any other locations that you can recommend that get their information from?
They should just go to ITP Australia and New Zealand, clearly. Of course, I'm not being paid to say that, I swear, because remember, she's got no money. Not sponsored at all. But no, in all seriousness, I routinely, for every single patient I diagnose, to the patient, to the carer, I say, you know what, you want reputable source of information that's kind of relevant for you being a patient in Oz. So go look up the, ITP Australia website, because that's got relevant information for us. Because, if you go to, say, the US sites and whatnot, we're not saying they're bad, they're excellent sites as well in terms of information, but they're going to talk about medications or therapies that we just don't have, right, for whatever reason. And it can be very different, and the access to the drugs are very different as well, right? So, if you're a patient in Australia and New Zealand, it kind of makes sense. You should go to, a region kind of specific, I think, source of information. And you can be rest assured the information on that side is reputable because, you know what, the medical advisors are responsible to make sure it is. So that's part of our...
Well, exactly. It's up to you. It's you guys are saying yes, green light it, and it gets on the website. So we have a number of new resources that we're putting out, and they have been sort of started to sort of trickle out amongst patients, but also we showcased it at Blood recently as well. The teen book, which is amazing, third line treatment information sheets for adults. Obviously the podcast and our conversation cards, which all hit shelves on mid-December, which is really exciting. A lot of that can't be done without people like yourself, without our medical advisors, because I'm not a scientist. I'm definitely not a doctor in any way, shape or form. So making sure that all of this information is true and correct. I know that there's a couple of new projects that we're all sort of collaborating on, which I think, again, is very exciting. It's another, opportunity for medical advisors to work with patient organisations to make sure that we all sort of see different things from patients and hear different things from patients, and making sure that we're plugging the holes with the information and the resources that are required. Out of everything, and for those people living with ITP outside of a cure, what do you hope in the next 10, 20 years for ITP patients when it comes to treatments or resources or programs, or in Australia and New Zealand specifically? Do you have any goals?
Geez, that's a bloody hard question, Danny. This wasn't in the brief.
No, it wasn't, but it's a good one to make you really think.
It absolutely is. I think for me, the number one priority now is really improving the quality of life for ITP patients. Really, as we both know, is as the title of this podcast actually says, is not just the counts, beyond the count. It's not just a platelet count. Is the disease burden and the treatment burden, and really the physical and the psychological impact of that, of what is a chronic disease. People like yourself and people in the audience that listen to this, they're the ones living the disease. They, of all people, understand, the struggles.
How shit it can be.
How shit it could be, absolutely, right? And we see somewhat what you're all going through. It's a significant disease burden, and we probably need to do more to understand, why do you feel so damn fatigued? What are we doing about it? There needs to be more research into what's causing that. How can we alleviate that for you, for the patients? And so there is, I think a greater focus on patients. And, obviously that's, in the last few years, has definitely been emerging, that we talk about what about the patient perspective, the Irish study, of course, and, the second part of that is coming, I think, currently rolling out.
Yep.
Understanding, patients' perception of the disease, and also, their lived experiences. I think that's absolutely critical for all clinicians looking after ITP patients, right? And so for me, I think that's kind of the next frontier, I think, to really try to improve quality of life as best we can.
I think it should just be part of every time you go to a doctor, regardless of the type of doctor, regardless of the type of specialist. I think understanding quality of life and how that is impacting that individual, not the patient, but that individual and that family unit, or, whatever. I think that needs to be considered when it comes to treatments and next steps and the information and the support that they receive as well.
Yeah, and you're absolutely right. And what I would love, now that you got me started, was sort of the goals is that I don't want to just have a clinic where it's just all medical. I would love to actually have access to a psychologist, someone's actually experienced dealing with patients with ITP or
rare disease,
or rare disease in general, because that is such a unique, I think, experiences that our patients with rare disease go through, right? They might never have met, and you and I have seen this, literally in a recent conference, ITP patient who's never met another ITP patient, right? The look on her face, the fact that she's speaking to you as another patient was just, which is amazing to behold. She was just so shocked that, oh my gosh, I get to talk to someone else who knows what I'm going through, right? So it's such a unique thing, living rare disease. And imagine having actually, someone to talk to guide them through, that disease journey. It'd be incredibly, I think, useful. I think that would be something I'd love to be able to have some funding for. Anyone out there? If you want to,
I've always considered one of the I suppose pie in the sky things that I would love to see, other than a psychologist dedicated to ITP or rare diseases specifically, is like a buddy system. Having like an ITP buddy system where two, 3 or 4, depending on the individuals, get together, touch base regularly to talk about what's happening. Instead of, us having to instigate everything, not that we don't want to, but people actually mucking in and, catching up with people because they need a chat or they want to discuss something or talk about what's happening in their lives. So I think an idea, but buddy system, 2027, let's put that out there.
I think that would be fantastic because, I'm going to put you under the bus here, Danny, because I know you absolutely get a number of DMs and, people reaching out to you, fellow patients, right? And there's only one of you. So if you can't, I can't even, and I know it's incredibly training on you too, right? Because you're
training, but it's really rewarding. Like it reminds me every single time why I do what I do.
Yeah.
And why we all do what we do. Like you guys see ITP patients all the time, whereas I don't. I'm isolated in Cairns, sitting here in the sunshine, enjoying the weather.
They isolated my ass. I know how much you travel this year. Please go,
yes.
Please go.
Yeah. Next year travel is also going to be pretty tough. But that travel helps us do a lot of the things that we can do as well. We work with a number of international medical advisors as well.
Right, yeah.
The likes of David Cooter, Nikki Cooper, John Semple, which are synonymous in the ITP space, and Cindy Nooner as well, and Drew Proven, and the list is just so very, very long. And then there's the International ITP Alliance as well, which you guys all met during the conference this year as well. That connection, and they're just part of the family. They're absolutely part of the family. So, but to be able to yes, connecting and working with those patients, because I don't, other than on tech or on the phone, I don't generally see patients often. I'm always communicating with them though, and you guys see them all the time. So it's that reinforcement that you get that phone call or that text message or that email or that DM going, hey, this is where I'm sitting, can you help? But again, we can't, without the knowledge that you guys have shared for me and with the volunteers as well, Patricia, Stephen, Stassi, we wouldn't have the education, we wouldn't have the knowledge that we would without you guys either. So being able to see some of the commonalities and the different nuances that come up across your conversations or Phil's conversations or Rob's conversations, and then talking to patients as well, seeing that wider net is, it's invaluable, absolutely invaluable. So definitely couldn't do it without you guys. That's for sure. And hardly anything would be done compared to, no medical information at all would be signed off ever.
Well, I must say you're pretty bloody good at herding us a bunch of cats around, that's for sure, Danny.
Well,
well done.
That's exactly what I do. I heard you all. Do this, do that, do this. This is your deadline. Go.
Yes, ma'am. Yes, ma'am.
But, it's all out of love and for the goodness of the patient at the end of the day.
And Danny, and thank you for being, really so inspirational, because really, yourself and of course, Patricia, Steve and Stassi, and then, you've obviously inspired, fellow patients to really rise up and step up to really, give back, to the ITP community in a way that has just never been done ever before. And, really, ITP Australia, New Zealand's the poster child of what an excellent patient support group looks like. It's the gold standard. And, and she didn't pay me to say this, I promise you. There's in the audience. But no, it's been amazingly inspiring to see what you've built. And it's been an absolute honour and a pleasure to have been part of it. So, Yeah, keep doing what you're doing.
And, actually being involved in, being a member of FANS. Yes, it's for haematologists and haematology nurses and, all these different
Students, no, free. If you're a student studying or a scientist, and anyone interested, it's free. I'm going to give a plug now with my FANS president hat on.
Yeah, definitely.
It's
FANS
free,
and
free
IST.
subscription.
So we're members for members of FANS. So we get all of the information, when it's available. We get all the information from ISTH as well about their upcoming conferences, ASH as well. We amongst, and we're getting that information day dot as opposed to hearing it from one of you guys, because you guys are so amazingly busy as well. I don't think you guys ever sleep. Let's put that out there. You guys don't sleep.
That's just Phil, actually. He's the one sending out emails at bloody 12:30 or some research question.
But yeah, no. So at the end of the day, you guys are extremely busy. Me sitting back waiting for you guys to tell me about X or Y, it's not realistic. But the other thing too that you guys definitely do is help connect us with other industry partners as well, because ensuring it comes back to making sure that the patient voice is incorporated into absolutely everything, and the patient is at the centre of everything that we do. We focus on that and we push that to our industry partners to show just how important and how important it is that we all work together really early on, because there's no, if we come in too late and then we go, oh, well, hold on, you haven't considered the patient and these things are going to need to change. Having to make those changes and pivot, sometimes drastically is not viable. Absolutely not viable. Whereas getting in early is really important.
Absolutely. And I think most sort of companies are now certainly aware of that now, and, inbuilt, I think, to their clinical trials programs, I think they actively are trying to include, patient voices, I think, their trial designs and asking patients, is this sort of outcome measure actually bloody meaningful for a patient? What's a good response look like? And what are some of the secondary endpoints that are going to be important? All these sort of things. And I think it works both ways. I know you're saying that, we sort of updated you on sort of things that are coming, but you've done the same for me, where you've been telling us, hey lads, have you heard of this new trial? We're like, what? No. What the heck is that? So, it's two ways. It's two ways.
It is two ways. Like I'm definitely going to say like 75-25 or 80-20. Like you guys definitely 80, us 20. But because I can get to a lot of these, ASH and ISTH and, blood and those sorts of things, I'm in their face a lot, which is really lovely. They sort of can't hide.
That's great. That's what you need.
And considering the profile of ITP has changed quite considerably in the last 10 years, and not just in Australia and New Zealand, but globally with the amount of clinical trials that are happening now.
Yes.
I think it's really important that we all really collaborate and work together to make sure that, we all know what's happening and where, and even start some of our own.
No.
Possibly one day.
Yes. That's we need to keep talking about that. But no, absolutely.
Watch this space. And encourage research as well.
I think that's so important. Thank you for raising that point, because really, we've mentioned clinical trials and potential new treatments. We can't do those trials without participation from, patients. People like yourself, Danny, who has a disease, who've got to make that in a way, small leap of faith to go on these trials, these new drugs that are, obviously very promising, but without people getting enrolled in these trials, without the trials being completed, we're actually not going to know, whether that particular, new thing is as good as we think it is until we complete the trial. So really, a small plug for clinical trials that, I think it's obviously sometimes a bit nerve-wracking to put your hand up for one, but it's an opportunity for us to test something.
There's so many. There are so many at the moment. I think there's 11 active clinical trials in Australia at the moment. 11.
Yeah, it's crazy. Like it's the renaissance of ITP research right now, and I think we're so blessed that that obviously our reputation, I think, as clinician researchers in the country, we're able to attract these trials.
And globally as well.
Exactly.
Because these are global trials. They don't just happen, here in Australia. They're happening globally, and we are punching above our weight.
Oh, absolutely.
Well and truly above our weight.
Yeah, absolutely.
Yeah, and without you guys, being the driving force, and Rob and Phil, I don't think we would have them.
Oh, we're just trying to keep up with you, Danny, because you're out there. We've got to hound the pharma companies too, right? To make sure they don't.
I'll keep them on their toes. Don't worry about that.
Yeah.
But no, at the end of the day, we've got to be able to deliver the results. It's easy to say, oh, we'll have this clinical trial, but if you're not going to deliver on the number of patients and help to meet some of those endpoints, it'll happen, but then that you'll start to see that trickle off, and to see that number is only ramping up and not down is, back to you guys, definitely. Really being able to enroll patients and encourage patients to run a clinical trial. I was on a clinical trial, weeks after I was diagnosed. So I know what a clinical trial can do for patients. I know what it can do for, for treatment access and those sorts of things as well. So I think it's really important. But that's a whole nother podcast, I think.
That's a whole nother podcast.
That's a whole nother podcast.
Yeah.
Definitely. Well, I think we're going to wrap things up there. Thank you so much. Catching up with you is always amazing and wonderful and electric and so much fun. I will be seeing you face-to-face in March at the patient conference. But until then, there will be plenty of emails from my end back to you on all the weird and wonderful new resources that we're pushing out, including our new dental and oral care brochure. Watch this space. It's on its way.
Awesome.
But we'll be in touch, and you'll definitely be on for another podcast, won't you, Danny?
Oh, yes, ma'am. Absolutely. It will be a pleasure. Thank you.
I love it so much. Absolutely love it. Thank you so much. You have a lovely rest of your day, and thanks for joining us on Beyond the Count.
Thank you. Till next time.
I hope you got a lot out of today's episode. Before we wrap up, here are 4 key takeaways from our conversation with Dr. Danny Hsu. Number 1, medical advisors provide expert guidance. They help shape safe, evidence-based treatment standards and ensure patient organisations like ITP ANZ share accurate information. Number 2, medical advisors make complex information understandable. Advisors take medical jargon and research findings and explain them in plain, practical language so patients and families can feel informed and confident when making decisions about their care. Number 3, their involvement strengthens advocacy. Medical advisors review resources, contribute to guidelines, and support conferences, ensuring patient organisations are credible and trusted. Number 4, families gain confidence through their role. Knowing that care is guided by the experts helps patients and families feel reassured and supported from day to day. Thank you to Danny for joining us today on Beyond the Count. We're grateful for the time that you've given to this conversation and for the ongoing support you provide the ITP community, helping patients and families feel informed, confident, and connected. If you're looking for support, connection, or information, visit itpanz.org.au. You'll find The Count, our quarterly magazine, patient stories, treatment information sheets, clinical guidelines, and a wide range of resources designed to help you and your family feel informed and supported. Most importantly, you'll know that you're not alone. There's a whole community here just waiting for you. If this episode was helpful, please share it with others in the ITP community and leave us a review on your podcast platform. It helps more people find Beyond the Count. We've got more expert conversations, patient stories, and more coming soon. So hit the follow or subscribe button to stay updated. Thanks for listening as we go beyond the count together.